few times within the first 1 or 2 weeks, which scared me a bit. Also, racing heart. I just at that point I didn't realize that it was also associated with a quinolone reaction, but I realize now that that was part of what was going on. But the tendinopathy and the ankle stuff was by far the most debilitating and the worst. A lot of people have had it worse than me, and I'm certainly not here to tell you that the physical stuff is the worst, because when you get into that darkness and that rut and the fear and the pain and the emotion of going through this and the cognitive effects of that drug, that can be the darkest of everything. And the fact that you have all the physical symptoms present simultaneously, it's just an unbelievable experience that I've never gone through. Nothing in my life, the hardships I've faced, could have ever prepared me for anything like this. And I really empathize with myself and with the other people that have gone through this. It's heartbreaking to read some of the stories of people, certainly the folks that are in their 20s and younger than me, that have been affected even worse. It does break my heart to read, the stories of the people that have gone through this. And I understand what you folks are going through. So that's been my experience with one dose, a 500 milligram dose of oral ciprofloxacin. And following up, of course, I'm not getting a lot of validation from the doctors. My PCP hasn't been a lot of help. I'm going to see a rheumatologist. Of course, there's still a slight possibility that there's something autoimmune, but given my ANA results and the C-reactive results, the fact that there really were no inflammation markers in my body at that point, which, by the way, doesn't indicate against tendinopathy. You can have severe tendon damage without high inflammation. If you research inflammation, it tends to peak at 48 hours and then significantly decline by 7 days. And by 14 days, 2 weeks, the inflammation in your body will have returned to a baseline level. So those inflammation tests that they were running on me 4 weeks out from the Cipro really didn't prove anything. They didn't prove anything but the fact that I didn't have inflammation in my body at that point. That does not indicate that you should be able to walk better, that you should be able to move better. If you've had some issues, some damage or some issues there with your sensory motor neurons, that can certainly affect your ability to ambulate. So don't get discouraged when these doctors tell you that there shouldn't be anything wrong with you, or they can't explain it, or they try to tell you that Cipro didn't cause it when you know that it did, and you know that you didn't have any of these issues until you took those pills, because they're only ruling out at that point everything that it might be. And because these reactions overlap with a lot of autoimmune stuff like MS and lupus, for example, or connective tissue disease, they're going to want to rule those things out. That doesn't necessarily mean that they're out to get you. What I found most difficult was the fact that they wouldn't even mention that it was possible, or I was told that it wasn't even possible that one Cipro would cause it. That indicates to me, I think in some cases, not some grand conspiracy against the patient, but the fact that this is a for-profit healthcare system. So you have to realize that these doctors are not going to throw another doctor under the bus. So even though I was on glucocorticoid for weeks prior to taking the Cipro, and it was given as a first-line drug, which the FDA has already specified that those are not conditions under which you're to prescribe Cipro. I was given the Cipro anyway. It was a mistake. They're not going to admit that. And they're not going to throw other doctors under the bus. If you found a PCP, you have a doctor or a specialist that's helping you and that has validated you and ruled some stuff out and said, yes, it's probably Cipro. I'm very happy for you. And I know I have read some accounts. I know there's folks who are out there in the medical community, and I'm grateful for them. But the fact that the doctors don't even want to admit that it's a possibility is very difficult, because it is very much a possibility, just like everything else. There's no reason and no test that they performed on me that ruled out mitochondrial damage and that ruled out a reaction to Cipro. Nothing that they tested me on did. They're just going on what knowledge they have of reactions to that drug and their own professional and personal experience, I suppose. So that can be very inadequate sometimes with respect. These are not stupid people. You're going to find a lot of people that are very angry and they're, oh, these damn doctors, they're not stupid. There's a reason why you're not getting any sort of validation, and some of it's legal. They're not going to implicate themselves in any kind of a lawsuit by sort of throwing bad shade on another doctor because they don't want to be a part of that. So they're not going to help you get a malpractice against the prescribing physician, number one. Number two, they're not going to implicate themselves in the future. And by that I mean that fluoroquinolones to this day are still one of the most widely prescribed antibiotics in the country. If I read correctly, it may be the most common prescribed antibiotic in the country. I'm not 100% sure on that, but it's certainly one of the most common class of drugs prescribed as an antibiotic for a range of issues. UTI, sinus infection, respiratory, prostate, etc. These doctors prescribe this drug on a fairly routine basis. They're not willing to admit to themselves, I think, in some cases, that these drugs are in fact that dangerous. So you're not going to get a lot of validation from them. It's important not to lose your cool, which I probably did at least once. But you want to keep your cool. You know, I wasn't disrespectful to anyone, but you're looking for someone to at least throw you a bone. You know, it's possible that the drug caused this because it did. And because in many cases where it may not be the drug, it's still a possibility until you rule everything else out. And I understand that. But it's never not a possibility, okay? Until you've been diagnosed with something that they can demonstrate conclusively with lab work, it's possibly the drug. And for those of us who've gone through it, we know it probably or definitely is the drug. In my case, I'm 100% confident that that's the case. I'll be happy to follow up with this either in the comments or with another video once I get tested by the rheumatologist, but I'm not looking for anything there because I didn't have any symptoms prior to the day that I took the Cipro. And all these symptoms are there in the FDA handout and in the side effect chart for this drug. It's known to cause tendon ruptures and tendon problems. It's known to cause peripheral neuropathy and the cognitive issues. It's been widely studied. The problem is, because we have this for-profit system, because you have doctors who are very reluctant to admit that a pharmaceutical that they use in their own practice is causing this, it's their own interest not to share with you that it's the case that Cipro caused it or that a fluoroquinolone caused it. So you have to realize that they're not stupid. They're protecting their own self-interest. And that can also include protecting the interests of other doctors, unfortunately, or the pharmaceutical company. This is very difficult to cope with, especially for someone who has had no medical history, you know, who's skeptical of doctors to begin with. I do have some compassionate medical professionals working with me, and I do have some good doctors, but none of them have uttered to me that it's possible that Cipro caused this, not a one. So that's very difficult. You're probably going to run into that more often than not, so be prepared for that. I'm not sure how to cope other than doing what you can to exercise if possible and look for support and focus on healing and, you know, finding some peace. So that's where I'm at with all that. It's been a very difficult ride. I'm at the 2-month mark, as I've said. I did feel like I turned a corner around 7 or 8 weeks. So just recently, within this week, about 2 months, I'm beginning to get some flexibility back. I still have some pain in my tissue and the tendons, mostly in my ankles, but of course now I'm getting it in my wrists, my shoulders. This has to do with the fact that I'm in bed a lot, and a lot of my muscles are atrophied now. I've lost a lot of weight since this has happened, 20, 30 pounds since the beginning of the year with the pelvic condition, but certainly a few pounds since this has happened of muscle. This is something that you need to be aware of, because if you lose muscle, you're risking yourself for actual physical injuries that the quinolones are not directly causing, but are indirectly causing. So try to keep strong if you can. It's been a rough ride. Try to keep your head up, and I hope that this video has been helpful. I will say that in conjunction with all the sort of the physical approach, the medical approach, the supplements, I'm not currently on any pharmaceuticals at all right now. I'm taking the magnesium. I take turmeric, which is another good supplement. It's relatively inexpensive. It's a good anti-inflammatory supplement. And I'm watching my diet. That I have begun to explore some mind body stuff. As I said, I do have a background in psychology. I have worked as a professional in mental health, not just with autism. I have done some mobile and outpatient therapy, and I hadn't really considered how deeply the mind body sort of paradigm goes, or that the fact that you may even approach that as your first model, rather than the medical model, which is that you have a car here and a broken part and they're going to fix it by throwing a drug at it. The mind body, or the sort of spiritual or TMS approach that was pioneered by Dr. John Sarno, who is now deceased, and of course the whole spiritual approach in general, which is meditative. It's Eastern in approach. It's going to help you sort of find an inner peace and an inner, I know that's kind of a cliche statement, but it will help you begin to identify your own thoughts and feelings, and not so much identify and attach to those mental phenomena. Your thoughts and your feelings about what you're going through can wreak havoc on your physical symptoms. So I don't want to completely rule out that I am manifesting some of these issues emotionally. But I think it's a blend with people that have a sort of psychosomatic or somatization syndrome. These aren't typically people that took fluoroquinolones. They're people who have pain that's just as very much real as yours and mine, but they've ruled everything else out. It's back pain or shoulder pain or ankle pain, and they've ruled everything else out, and they've been given something like a fibromyalgia diagnosis, which is a general diagnosis that you'll get from a rheumatologist when they can't find anything else wrong. And then they're going to throw a bunch of anticonvulsants at you like gabapentin and other drugs to just kind of calm your nervous system down and tell you to just deal with it. It's a chronic condition. And that's nothing that you want to hear. But the problem with a fluoroquinolone is that you do have physical symptoms. Tissue degradation, tissue destruction can be demonstrated in imaging tests. Cognitive issues are real and can be demonstrated through clinical research. So what we're going through is physically demonstrated in research, and in many of our cases, not mine because they didn't do an MRI, but I'm sure that there was tissue damage there in my ankles, and I believe it's still there. The extent to which I don't know. But they didn't perform those tests because we're back to the for-profit thing, and those tests cost money. Then your insurance company gets involved, and it becomes this big game called how can we screw the patient by giving them as little care as possible. And it's not always that the doctors want to go that route, but in their defense, the insurance companies in this country tend to wield more power now than your medical practitioner. So even if they wanted to have MRIs performed, it could have been the case that the insurance company doesn't want to cover those costs. At any rate, fluoroquinolone flocks to people that have had reactions to fluoroquinolones do have physically demonstrated and clinically significant pathology demonstrated in imaging tests and other blood tests. But how long does that last? Where's the line between where your body begins to improve and you're beginning to somatize it because you're so traumatized by the experience, by being trapped in your own body, that you're afraid to move because you've read all these horror stories? Because the median experience for people, the median 50% of the people who have a reaction to quinolones have it after 7 days. The other half, like myself, have it up to 7 days. But I don't think these groups are exclusive, so you can certainly experience symptoms in the first 7 days and then go on to experience those symptoms again or new symptoms later on. I didn't have issues in my shoulders initially, but I'm developing rotator cuff, what feels like rotator cuff. I don't know if that's what it is, but pain. Sometimes I feel like my shoulders are noodles. I can't even pick them up. My whole connective tissue system has been affected, and this seems to be ongoing. It does seem to be improving. That said, there is a point at which you're going to realize that you can begin to move. You can begin to get up. You can walk. You can begin to bear weight on the affected areas. Now, you need to, of course, be very, very careful. Be very careful stretching. I think that I stretched my calves a lot a few weeks ago, hoping that that would help, but I was very careful, but I felt like that set me back a little bit because it was too much too soon. So there's a very fine line between what you can and can't do. And this is where the fear is. Am I going to push myself and cause more tendon damage? Am I just making this condition worse? Am I just sustaining it? Or am I actually improving it? You do need to move, because the longer you stay immobile, the more your muscles atrophy, and the more you're setting yourself up to just perpetuate the condition, because weak muscles put a strain on tendons. So this is a really bad situation to be in. But it is important to explore the mind-body issue, because your emotions about this, the fear, the anxiety, can generate and I think amplify the symptoms that you're going through and make it even worse. I have some symptoms right now. I've got some tingling just by being in a chair and sort of leaning on my knees and putting some weight down. I can feel it tingling in my ankles. It's uncomfortable. I've grown used to it. It's not incredibly painful right now, but I'm a little fearful if I get up and walk around. But I'm kind of moving and doing the best that I can with it. You need to begin to explore how much your emotions and your thinking, identify your thinking patterns. Recognize how much time that you're spending in support groups trying to be supportive to others and seek validation versus fueling a sort of negative feedback loop of fear, thinking that you're going to rupture your tendons because this person did and that person did. Not everybody has tendon ruptures, and a lot of people do recover at their own pace, however many weeks or months it takes. A lot of people make a full recovery, and I'm hoping to be one of those people at this point. I'm hoping that I don't rupture. I do have these fears still in the back of my mind kind of gnawing at me, but it does seem to be gradually improving. You may want to speak with a therapist. A psychiatrist is going to want to give you medication, probably to treat depression and anxiety. Maybe that is a good option for you. It's something to consider. But don't let that be sort of, as the medical community would have you have it, sort of a primary diagnosis or primary issue, the somatization, because in many of our cases, those of us who've had reactions to these drugs, we have somatization in conjunction with genuine clinical pathology there in the tissue. So it's a little bit of both. And you get so traumatized by this stuff, you're not really sure literally which way to go, which way to stand. But there is hope. I am making some progress. Sometimes progress means standing up, standing for 5 or 10 seconds and sitting back down. Sometimes it means walking to the bathroom, but that's kind of where I'm at right now. If I can make it downstairs, down the steps, one step at a time, and have coffee that day, it's a good day. And it's improving, because that's a lot better than where I was. So there is hope. I can update if there's any interest in this video, maybe in a few weeks or in another month, to see where I'm at. If anyone's interested, I hope that my story and my experience has been helpful to others. If you are interested in exploring mental health and a counselor or a therapist or even a psychiatrist, I would encourage that also, to treat with some of the cognitive and emotional problems that come up with an illness like this and an issue like this. It's extremely difficult. It's very dark, and I understand for those of you going through it and that have been through it, what it is. And I'm here. So I hope you folks have a good day, and you keep your chin up, and good luck.